How can automatic oxygen therapy improve the treatment of COVID-19 patients and reduce the work pressure for nursing staff? Hospitalised COVID-19 patients are in need of oxygen therapy, often due to fluctuating saturation of oxygen in the blood. This is because the COVID-19 virus causes inflammation between the alveoli and the blood vessels. Fluid here may accumulate in the lungs and cause the patient to have difficulties absorbing oxygen. Consequently, patients will need accurate and frequent adjustments of the oxygen flow. And each time healthcare staff will have to sanitize, equip themselves with personal protection equipment, and then enter the isolation room to manually adjust the oxygen flow, before then leaving the room again. O2matic is automatically able to accommodate the varying need of oxygen flow. As the patient's ability to absorb oxygen decreases, O2matic increases the flow of pure oxygen. This leads to very targeted saturation. Then, as the lungs' ability increases, O2matic decreases the flow, once again according to the patient's current needs. A study of 1,000 hours of data has been collected, looking at the automated oxygen treatment of COVID-19 patients with O2matic. The patients were all adults and had an average age of 72. O2matic has demonstrated its ability to keep the patient's saturation stable more than 83% of the time. Around 7% of the time, the patient is receiving minimum or maximum flow, without saturation reaching the target. In the remaining 10% of the time, patient saturation is typically only unstable in short periods of less than 5 minutes. 60% of the patients reach the target saturation within just 1 minute. O2matic adjusts the flow every second to keep the patient stable. This, of course, would be impossible to replicate using manual labour. Looking at the flow changes that could lead to a change in prescription of flow to the patient, that data shows a need for at least 2 adjustments every hour for each patient. For a COVID-19 department with 20 patients, this would mean 40 visits per hour. Each time, healthcare staff would have to hand sanitize and change PPE equipment, and all this just to alter the oxygen flow manually. For more information, contact info@o2matic.com or visit o2matic.com.